Okay, everyone, this is Emily Mongrovius. Thank you for joining us this afternoon for our webinar about the Office of Early Childhood. I have my colleagues here from that office, and we're delighted that they could join us. I'm going to go ahead and have them introduce themselves, and then we'll get started. Oh, and I wanted to let you all know, too, that if you have questions, please either raise your hand. You can type your questions into the webinar or use the chat feature. Thanks so much.
So, what's going on?
I think somebody put us on hold, so hold on. I'm going to put this on chat and let everyone know. So,
Tell them the music's playing.
thank you. Okay, so here we go. Without further ado, Mary Ann.
Hi, everyone. Good afternoon. My name is Mary Ann Snyder. I'm the director of the fairly newly created Office of Early Childhood, and I have several of my office colleagues here with me. We want to make sure you know who's in the room and what expertise is in the room so we can answer your questions.
Hello everyone, my name's Karen Rosa and I'm a licensing administrator with the Division of Early Care and Learning, and I'm actually filling in for David Collins today.
Good afternoon, Tammy Graham, Director for the Division of Community and Family Support.
Hi, my name is Stacy Kennedy. I'm the Grant Director for the Early Learning Challenge Grant with the Race to the Top.
Good afternoon. My name is Keisha Russell. I am the Child Care Assistance Program Administrator.
All right, so we're going to go through a PowerPoint that will provide you with a number of different pieces of information, some information on the structure and how the new office came to be. We also are going to include some of the new legislative and budget initiatives that we're working on, and an initiative called Two Generations. So it's kind of a little bit disjointed, but we'll get through all that. And we certainly encourage questions throughout the presentation, and if you have related questions to our work or recommendations, information for us, we certainly want to hear that feedback as well. So I will start. This is Mary Ann, and moving to the first slide. As many of you probably know, that 2 legislative sessions ago, there was a bill introduced to create a new Office of Early Childhood with the goal of moving a number of programs that sat in a variety of state agencies under one roof so that we could work on making a high-quality early child system that was more seamless and available for families in Colorado. And so you can see there that the Office of Early Childhood's goal is to provide resources for children, families, and early care professionals to best prepare Coloradans for future success through collaborative, coordinated, quality early childhood programs and supports. And I'd like to start the conversation by saying, you know, why? Why is this important? Why now? Why do we need this? And you can see that more than 65,000 Colorado children will start their first day of kindergarten this year. And we also know and estimate that 16,000 of those children arrived in classrooms behind their schoolmates or unprepared or not ready to learn. We also know that the high school graduation rate in our state is 75%. And of that, only 68% of high school graduates attend a college the year after they graduate. And we know that of the 63,245 third graders, only 73% will meet or exceed the state standards for the Transitional Colorado Assessment Program. Maybe even more alarming is that our 8th graders scored proficient or better in math only 43%. And high school kids who begin a post-secondary education program, nearly 40% need some kind of remediation to help them get started. So the Office of Early Childhood has many goals, but the overarching goals are to ensure that every child comes to kindergarten healthy and prepared and on an equal footing with other children, and that by 3rd grade they are reading at proficiency or better. This is a huge marker in terms of overall life success and to be a productive citizen. Kids who go to kindergarten behind their peers, the data is pretty clear that it's very difficult for those kids to catch up. I'm not saying that kids aren't resilient, but it's an uphill battle. So this office is all about prevention and making sure we're starting at birth and going through 3rd grade with a lens, a cross-domain lens, and I'll talk a little bit later about the framework we're using. So on this next slide, you can sort of see what some of the overarching goals are. Access to necessary supports for kindergarten readiness and reading by 3rd grade. A lens on everything we do to support continuous quality improvement. Obviously, we can't do this alone. Creating the office wasn't an easy fix. It does provide us opportunities to coordinate with very significant systems and programs, but we need our partners at the local level in our counties as well as our philanthropic and business communities to recognize this and take a role in it. We know that more children need access to high-quality early care settings and that kids don't exist by themselves. They live within families and communities, so we have to take a look at the supports and services that are available for families and the community at large. I sometimes like to say we have to create communities within which it's much more difficult for families to fail. So there's a lens in the office not only on direct services, but on population-based approaches to supports. And of course, we have kids who do have delays, and so we want the best coordinated system of early identification and early intervention. So I mentioned earlier that there's a framework. I suspect many of you, if not all, are, I hope, familiar with this. But this early childhood framework is excellent work that was done here in Colorado way before I took this position. And so we are trying to frame all our work within these domains of early learning, family support and parent education, social, emotional, and mental health, and physical health. So if you haven't looked at this framework, I can tell you I've looked at many of them across this country, and I honestly think Colorado has one of the most succinct, articulate, and comprehensive frameworks. So I would encourage you to look at that. You can find it on the Early Childhood Colorado Clearinghouse website, or you can get to it through the Lieutenant Governor's website. So this is a little bit of a repeat of, just stated in a slightly different way about what we include when we are referring to an early childhood system. You can see that we care about pregnant moms and families, so this all starts with a healthy prenatal care for everyone. What is happening in our child care and preschool settings in terms of quality and access, what's happening in our kindergarten through 3rd grade, And then the domains that were discussed in the framework, health and nutrition and social emotional development and resources for families and communities. And in addition to that, there's a significant focus on the early care professional development system. So the office was created, we tried to create it in statute 2 years ago. We were unsuccessful in making that happen, and so the governor and the lieutenant governor and the heads of education, health, and human services decided that this was such an important part of their agenda that they went ahead and moved as many programs over and created an Office of Early Childhood. Every program they could move over without statutory authority began to happen this past June, a year ago June. Then I was hired in November as the director of the office and got thrown right into the legislative session, and we successfully passed HB 1113, which finished up moving over the rest of the programs that were part of the vision of this office. And we will talk in a little more depth about that, but you can see that the Office of Early Childhood has two distinct divisions, the Division of Early Care and Learning and Community and Family Support. And then we are so grateful that Colorado was a successful second round applicant for federal Race to the Top Early Learning Challenge grant funds. And so that was a bucket of $30 million, which is resources for everything, all the goals I've already highlighted. In addition, I hope most of you know that we also just sent out a press release on receiving an additional $15 million in what we call supplemental dollars, so an additional amount to help us carry out some very heavy lifts over the next 4 years. And then, okay, so the slide that's up here now specifically identifies the additional programs that moved over. So you've got the recreation or recodification of the Early Childhood Leadership Commission, we will have our first meeting in September. All of the home visitation programs that were over at CDPHE, the Colorado Children's Trust Fund and its board, as well as the Head Start Collaboration Liaison. Have we skipped to that point? Okay, we're going to skip around a little in the PowerPoint. And I want to just at this point, before we get into some detail about the divisions, maybe talk about an umbrella initiative that is of great importance to Executive Director Vika, and it is called a two generations approach. So to sort of give you a sample of that, I'm going to share a little Colorado story. So you can see here that women and children in single mother families have a disproportionately high rate of poverty, not news to anyone on this call. Nearly 3/4 of children living in single mother families are low income, compared with just 1/3 of children living in married couple families. We know there's a strong correlation between low levels of educational attainment and poverty. Only 10% of those with a bachelor's degree are poor, and over 30% of those with a diploma or less are poor. So the two-generation approach it's really talking about moving families out of poverty with 3 specific lenses, making sure that both children and families together are receiving and benefiting from economic supports, education, and what we call or refer to as social capital. And there are a lot of other buzzwords that are used for social capital, but it's a combination of having a group of peers who are struggling and experiencing the same lifestyle or poverty that the families might be in, learning from each other, sharing some empathy, and realizing how they can help each other. So you might have one single mom who has a car that works, and she can help another family get their child to care every day so she can make it to work. So it's not rocket science, and it's frankly not a new approach, but what we are working very hard in the entire department is every initiative that we possibly can to make sure that we are facilitating and thinking about a two-generation approach, because everyone knows about the cyclic nature of poverty. So if we are really supporting children and their parents at the same time, there is research to support that you're more effective at breaking that cycle. And economic supports, most of us know about Maslow's needs hierarchy, right? If you don't have your basic economic needs met, it's hard to focus on anything else. So here are a few examples of the kinds of economic supports that we are focusing on. This is just really, a nice little picture about what I just explained. Okay, so now we're going to go back and talk about specifically the Division of Community and Family Supports. And for that, I'm having Tammy Graham lead this, our new Division Director.
Good afternoon. Thank you for being present at this presentation, and I'm going to cover with you the different programs and initiatives in the Division of Community and Family Support. You see the list there on your screen, but I'll give you a little description of each one, starting with the Early Childhood Council Initiative. The Early Childhood Council Initiative was established in Colorado to create a coordinated system of early childhood programs and services throughout the state. There are 31 councils that cover 58 counties. Through state and federal funds, the councils are funded with about $5 million. The next program is the Early Intervention Colorado program. Early Intervention provides a statewide, comprehensive, coordinated, multidisciplinary, interagency system of early intervention services for infants and toddlers birth through age 2 with developmental delays or disabilities and their families. Those services are provided through the 20 community-centered boards throughout the state of Colorado. The next program is the Early Childhood Mental Health Program. There are 17 early childhood mental health specialists throughout Colorado, and these specialists focus on increasing access and availability of mental health services statewide, including services for children from birth through age 5, by aligning early childhood services and mental health services to improve well-being in child and family functions and relationships. Many of these services are provided in the community in early care and learning settings. These mental health specialists are employees of the mental health centers. Promoting Safe and Stable Families is funding through the 4E waiver to provide some permanency and safety for all children, providing supports to family in a flexible, family-centered manner through a collaborative community effort. One of the newer programs to the office is the Nurse Home Visitor Program, which was one of the programs that transferred over from the Colorado Department of Public Health and Environment as of July 1, 2013. The Nurse Home Visitor Program is state funded through tobacco settlement dollars, and is really a state collaborative effort through Investing Kids and the university. They implement the Nurse Family Partnership Program. They provide first-time moms valuable knowledge and support through pregnancy and until their babies reach 2 years of age. The other home visiting programs that are funded through the federal Maternal, Infant, and Early Childhood Home Visiting Program is more of a continuum of home visiting programs to improve coordination of services for at-risk communities and identifies and provides comprehensive services to improve outcomes for families who reside in at-risk communities. This funding is about $22 million from 2012 to 2016. There's 6 different home visiting models used within that funding. Additionally, the Colorado Children's Trust Fund and its board was moved to the Division of Community and Family Support to assist in primary prevention of child maltreatment by teaching parents about parenting, child development, and providing services for healthy social connections. Additionally, the Family Resource Center program provides training, technical assistance, and grants to establish and maintain family resource centers that provide services for vulnerable families. We also have a couple of joint initiatives with the Office of Children, Youth, and Families. First, the initiative for Nurse Family Partnership Augmentation, and next I'll talk to you a little bit about the Community Response Program. Nurse Family Partnership Augmentation will provide increased number of referrals to NFP and increase the rates of enrollment, works to strengthen local and state nurse-family partnership and Child Protective Service collaboration. Also, there will be some training provided to nurses in the prevention of child abuse and neglect. Community response, the goal of this program, which will initially start out with 6 pilots throughout Colorado, the goal is to reduce incidents of child abuse and neglect, increase stability in the home, avoid the higher costs associated with providing child welfare services, and improve the link between economic security and child abuse prevention efforts. Participation in this program is voluntary, and the plan is to reach out to families earlier when they are stressed and before problems escalate. The components of the community response services include case management, home visits, collaborative goal setting and family engagement, direct services and resource referrals, both economic and non-economic resources, and flexible spending. Community response targets families who have been reported to child welfare system for alleged child abuse and neglect, but those whose cases are screened out. In Colorado, approximately 55% of all referrals are screened out, and these families are deflected from child welfare without receiving outreach and support. There's also a picture there that shows you the continuum of supports for families, which includes the traditional CPS, differential response, community response, which fills the gap, and then family support services. In February 2013, the Office of Early Childhood and the Office of Children, Youth, and Families received funding to establish a community response program. And there's a little table there for you to see that we'll initially start with 6 pilot sites that will be funded at $150,000 per site. And then in fiscal year 14-15, there will be 12 sites, and in fiscal year 15-16, 18 sites. And now transfer this back to Marianne to talk to you about the Colorado Infant and Toddler Quality and Availability Grant Program.
I'm sorry, I have a question. Do you want us to hold questions until the end?
No, go ahead.
So for the community response, will that be issued through an RFP, or how will that implementation and site selection occur?
So this is Marianne. So a couple of points. We have created a sort of child welfare prevention steering committee, and there are 2 subcommittees within that, a community response subcommittee and a nurse family partnerships augmentation safe care subcommittee. So yes, it is an RFP. And the draft RFP is going to that committee for edits and additions, recommendations. I don't have the exact timeline on the issuance of the RFP, but we're trying to get it out the door as soon as possible. We are also advertising. Here's a little advertisement for community response. We are hiring a position. If anyone has some interest in that, I don't believe it's closed yet. There also was another question.
Said when the time is right, will you talk more about the distribution of promoting safe and stable families?
So we are busy trying to respond as a new office to some of the great requests and questions that are emerging from our county partners, and it's definitely on our radar screen to be taking a look at how the allocation formula was developed for promoting safe and stable families, as well as, there's one other one that I'm drawing a blank, and for the early childhood councils. So both of those items are definitely going to be addressed in the coming months. Beyond that, the work hasn't really started, other than it's certainly been brought to my attention and that we need to take a look at it.
Then we did have a question, but it might have already been answered about the community response, about the implementation plan for the community response. So I think that you've already addressed that. So. Let's see. And I think
that was my question, and it was answered sufficiently. Thanks.
No problem. Thank you. I think that's it that I see right now for questions, and so I think we will go to the next part.
So I mentioned in the beginning that there are a number of things that Tammy's already talked about. Our budget wins with the legislature, including the money for community response and home visitation. But in addition to that, there's a growing recognition with the legislature that we have a significant problem in terms of availability and quality of infant toddler slots, especially for our lowest income children. So to that end, the legislature did give the department through our office $3 million to incentivize the development of new slots as well as improve the quality of existing infant toddler slots. And part of that is to incentivize tiered reimbursement. We recognize that child care providers who are taking subsidy children are not getting reimbursed at a rate that even covers their cost. So this is exciting. This money is ongoing funds, and I think a beautiful opportunity for us to see all the creative ideas that are out there on how we can improve quality for infants and toddlers. Again, most of you probably know that this is a joint application between the early childhood councils and the counties that are in their service area. I know the RFP has been issued, and I'm not sure what the deadline is. It's coming up in the next couple of weeks. So yes, and I talked about the tiered reimbursement, but we also know that parent engagement is critical, so that's a part of the model as well. So I've talked about the partnerships of who can apply.
And if there are not any questions on 1291 at this point, I'm going to turn the mic over to Karen Rosa, who is our new licensing administrator. Unfortunately, David Collins is the director of the Division of Early Care and Learning, and he's a little under the weather today.
I'm sorry, can you please address what the opportunities are for counties who are not affiliated with the council?
Yeah, and if you access the RFP, we are encouraging counties who are not affiliated with a council to work with a neighboring council. That is the best we can offer right at the moment, because in statute it requires a joint application. Having said that, I just want you to know that it's on my radar screen that we, as I understand it, have 6 counties that are not affiliated with councils. And I guess I'll say a couple more things about councils now that I have the mic back. We are, and I am, with the help of Tammy Graham, the division director, going to be leading up a strategic planning initiative for our councils. And part of that initiative is to address that very issue, or part of the strategic plan is to address that issue with counties, not in isolation from, but with the counties that don't have an affiliation, and a strategic plan that identifies sort of shared measurements and shared outcomes for our councils, as well as reviewing the way the allocation is currently distributed. I don't think that it is fairly distributed, and it hasn't been looked at in over 10 years. And I will add that all of the councils are in agreement and very willing to be team players and take a look at how we can distribute those dollars a little more widely and fair so that we can be more effective.
Thank you.
You bet.
Okay, so good afternoon, everybody. This is Karen Rosa, and I'm going to speak about the Division of Early Care and Learning, and I'm really going to cover 3 key elements that we work with in our division. So child care quality initiatives, child care assistance program, and child care licensing and administration. The first element that I'm going to speak about is our child care quality initiatives. So the Division of Early Care and Learning funds the development and implementation of programs that support the growth of an early childhood system in Colorado, ultimately resulting in an early childhood system that provides resources for sustainable increases in the quality of care for children. So one example of this would be our School Readiness Quality Improvement Program, where we fund ratings, coaching, and materials in classrooms in school districts who have been identified as low performing. Another area that we cover within the division is the Child Care Assistance Program, which I'm sure most of you are extremely familiar with. And that's where we provide child care assistance to low-income families that are working, searching for employment, or in training, and also families that are enrolled and working in the Colorado Works program and need child care services to support their efforts towards self-sufficiency. The third piece we really cover is the child care licensing and administration, where we monitor, regulate, and license child care facilities across the state, and we promote child care quality by ensuring consistency and safety standards that are realized at all licensed child care facilities in Colorado. One big initiative that the Division of Early Care and Learning is working on right now is a nutrition and anti-obesity campaign. We're working with local early childhood councils statewide, and we're providing nutrition and anti-obesity training to advance to trainers throughout Colorado. We actually were able to, in May, do a I Am Moving, I Am Learning, Train the Trainer training. You could say that 3 times fast. But where we trained actually over 40 trainers, and that representative regions throughout the state of Colorado. And so what they'll do is they'll be able to go back into their communities and provide training to programs And then those providers will be able to use that training to provide age-appropriate curricula with, to teach children within their care. And they also will be able to provide information to the families of those children. The curricula will include health and nutrition and economic hardship and safety. And the great thing is if they do promote this curriculum and provide it within their facility, they'll be able to receive points towards their quality rating and improvement. So the division is also working on 3 two-generation initiatives. The first being child abuse prevention, and then I talked about the nutrition and obesity, and then also a children's savings account, two-generation initiative. And so that's really my piece unless somebody has questions.
Thanks so much. I just wanted to let everybody know that we will be sending out the PowerPoint, and we are recording the webinar too, so it should be available on the county portal that we are hoping to launch on August 15th. So, thanks.
Okay, hello everyone. My name is Stacy Kennedy, and I'm going to talk a little bit about the Race to the Top Early Learning Challenge Fund. When you look at the fund, it really sits within 6 different areas of which you see on the slide. The first is thinking about our overall grant management and supports within the state, and how we align and collaborate more closely at the state level, and then leverage our partners specifically with the early childhood councils on the local level. The second area is a tiered quality rating and improvement system, which is focused on improving program quality with a focus on continuous improvement. Many of you may know we already have a rating system in place. This is the next generation of that effort. And one of the biggest changes related to the tiered quality rating improvement system is that the next generation will sit within our licensing department. Early learning and development guidelines. These are guidelines that went through much vetting within Colorado, received significant input, and were refined to reflect what we would expect children birth to age 8 years of age to be doing. And so we're using these materials to support both professional development, but also to really better align our communication and strengthen the communication that we have with families as their child's best advocate, and just understanding the activities that they need to undertake and roles that they play in supporting their child's development. A highly qualified workforce is another area of the grant, and it's actually sits within our partnering department, the Colorado Department of Human Services, the Colorado Department of Education, where there's a professional development team looking at aligning competencies across the various programs, and also seeing how that fits in with credentialing within the community colleges as well as the four-year institutions. And then the last 2 areas are focused on child level, conducting assessments using a validated instrument. The Results Matter expansion is looking at children prior to entry into kindergarten, so that individuals supporting those children have a better understanding of what those children need to learn and grow. And then the statewide kindergarten readiness assessment is happening at the school district levels within kindergarten classrooms, again, as a check-in to know specifically what children need upon entry into kindergarten, and to support them as they move through the school system. Next slide.
So this next slide is a way that I like to think about it, not so much in the 6 different buckets, but to really think about how all of these things tie together to lead to our ultimate goal of having the strongest early childhood system that we can in Colorado. So again, we're looking at smarter management and leveraging our councils to help us better understand the unique needs of our state. We know that there's variance amongst the different counties and the different areas within the state, and so we utilize them as a resource to best understand how we can approach and support the efforts happening within the different areas of the state to help child care programs, for example, understand moving up the levels of quality, and again, helping families to best understand child development and how they can play a role in supporting their child's development from birth to 8 and then beyond. The quality early learning is really speaking to the tiered quality rating and improvement system. Again, a big shift is that it is moving into licensing, so if you are a licensed entity, you will automatically fall into a rating. We're working on credentialing bodies for child care centers to determine exactly how those credentialing bodies map in and fit into the new tiered quality rating and improvement system. And then we're also obviously going to honor those situations in cases where where programs or child care programs have already been rated. So if you think about it in this way, the quality early learning component of this really helps us best understand what quality looks like within a child care entity. Then you move on down the equation into quality workforce. The competencies are being mapped, as I said, to many different disciplines, both formal and those that may not have a formal credential or something obtained within the higher education system. And one of the results of this particular area is really the creation of a professional development information system, which is a way to create effectiveness amongst this field by allowing individual professionals to create their own professional profile that they have control over in terms of access, but that can help them move in situations where they are changing employment and create efficiencies in that they're not having to keep track of this information for themselves. It will continue to keep information like background checks, which is a big thing, and allow their receiving employer to have access to that information so that that individual, in cases where they are changing employment, can begin work on day one and not have to wait for many of these checks to be repeated over and over as they move throughout the system. The system also will work as a way of really supporting technical assistance and knowledge, and we envision the system to be able to automatically populate that child care professional's profile so that they're obtaining credit for pursuing knowledge and information related to the competencies. So essentially it's letting us know what we would expect from a quality workforce. And then finally, we focus on all children through better understanding their learning and development, but especially those children with the highest need. And in the grant, these children, the term highest need is defined as children who live in families with low income, children who have a developmental disability or delay,
who are English language learners, who reside on Indian lands, live in migrant families, children who are experiencing homelessness as a result of the situation of their family, those children who live in foster care, and then finally those who are recent immigrants. We know that having inclusive child care facilities and early learning and development entities that are inclusive will benefit all children, and actually all of the children will be beneficiaries of having that inclusive environment. So what this means is that we have new resources for all Colorado children, their families, and early childhood professionals. We will be increasing access to early education services and supports for Colorado's highest needs children. We will be creating incentives for early childhood education providers to increase the quality of programs. These will happen in the form of Teach scholarships, which will go directly to early childhood professionals. This is something, again, that's not new in our state, but through the grant will be launched in January of 2014. But it also will include other more flexible opportunities for early childhood professionals in the form of coaching. These represent investments in the early childhood workforce, and ultimately we know that all of these things in combination will lead to better outcomes for Colorado's children. So one of the questions that we suspect is going through is how will the funds flow? And so I want to just make a quick correction to this slide. The funds actually start with the Department of Human Services through the Office of Early Childhood, and then we partner and flow funds to those initiatives that are being led by the Department of Education. So the funds then go to early childhood councils, local early care and learning providers who access the incentives to Teach scholarships or other forms of ongoing education and support, or TA to move from lower levels of the TQRS to higher levels, and then specifically to early childhood professionals. And then the incentives for local providers and professionals for ratings, supports, workforce resources, and greater access for the highest children of needs. Just in full disclosure, we are still working through exactly how those incentives will look exactly. We're in the process of doing a cost modeling for our state, and so we are getting a better sense of what those various factors are that contribute to a center moving from one level to the next, and essentially really putting in the overall structure for quality within their program. And so until that cost modeling is done, we won't have a clear sense of how those incentives will be necessarily defined, and how much we'll be able to contribute to those centers who are interested in moving up the level. But the significant portion of the funding within the Early Learning Challenge Grant really is focused on this particular area. So the goals of the grant, if we were to look at the various metrics in terms of increasing quality, is that all licensed early learning programs will participate in the new TQRS, again, because we're embedding the rating system within our licensing system, and that ultimately 35% of the center-based child care programs will rate in the highest tiers. And the overall rating system is going to be 5 levels. And so really we're talking about levels 3 through 5 on the next generation
tiered quality rating and improvement system. Strengthening the workforce. 100% of Colorado community colleges and 50% of the four-year institutions will incorporate the new early childhood workforce competency framework into their early childhood education degrees. 10% of the professionals in our early childhood workforce will advance at least one credential level, and then 25% of the professionals will make progress towards the next credential level. Finally, preparing all children for success. These metrics include that all children in public schools will receive targeted instruction by participation in the kindergarten readiness assessment for year one. It's a voluntary process whereby school districts in your area are contacting the Department of Education to participate. Moving forward, it will be a requirement for all of those school districts to implement the kindergarten readiness. And then the last few bullets related to this is that we will establish a statewide baseline of school readiness through the kindergarten readiness assessment, and that we'll see ultimately a 25% increase in school readiness within our state, which speaks to the slide that Marianne led with. So I'm going to pass the mic over to Marianne so she can wrap up and talk about our CSTAT measures within the Office of Early Childhood.
Thanks, Stacy.
So are there any questions regarding Race to the Top? And a lot of information Stacy has thrown at you. Okay, so I just kind of wanted to wrap up by talking about the department's serious focus on data-driven decision-making. And I would suspect that many, again, if not all of you on the call, are familiar with this. But we're a new office, and so we are in the process of developing our own CSTAT measures. So CSTAT is an activity of mining data to inform our decision-making and policy-making work. It is department-wide. Every office director once a month has an hour-and-a-half slot where we present our progress and new data based on our various CSTAT measures. We're looking at data that we can mine as close to real time as possible. We include our entire staff in some capacity to identify data, come up with new ways to look at that data, and quarterly those reports are published, so Jess tells me, on the CDHS website. So we are also about transparency and improving our work for the citizens of Colorado. So these are incredibly interesting. We are still developing measures, especially for the new programs that Tammy talked about that have very recently moved over from CDPHE. But just to give you a little snapshot of what some of our current CSTAT measures are, you can see on the Division of Early Care and Learning, we are following a number of indicators and measures related to the efficient payment of subsidies, our CCAP program. We'll definitely be following up more, I know, on the child care quality side through Race to the Top and the initiation of tying the rating of centers to licensing beginning in January of 2014. We're concerned about the number of serious complaints and injuries that happen in facilities and homes, so we're tracking that. On the side of community and family support, we've focused heavily on our success in the early intervention program to serve kids 3 and under with developmental delays. You can see a number of measures there. And I think one of our early successes as a result of looking at data differently, or sometimes just looking at data,
is finding out that the children 3 and under who have a substantiated case of child abuse by law, federal law, are to be referred to the early intervention program. That was over 3,000 kids last year, and when we started looking into it, only about 900 of those children actually were referred, and more alarming, only 50% of those referred completed an assessment. So as a result of that, which is true of many of these measures, there's over-the-shoulder coaching going on. We are looking at some policy issues, possibly making that cohort of children just categorically eligible. So I have found it to be a very effective way of thinking outside the box and questioning why we do things the way we do things. So in all areas of the office, I just would encourage you to reach out to myself, to Tammy, to David, anybody on our team. If you have ideas, concerns, questions, measures you think we should be looking at, we have an open door policy in this office, and we welcome your feedback.
Thanks, Marianne, and thanks to the office for coming up and giving this great webinar. I wanted to check with everybody to see if they had any additional questions. We have a few minutes, so if you have them, you can either put them into the webinar and ask them, or you can ask them over the phone. We did receive a question about finding the trained person for the program.
Yeah, so we had a question about, for the I Am Moving, I Am Learning, the training that we did in May, how you could find your trainer in your community. If you actually would contact your early childhood council, they should know who is trained within your community, but I can also, if you send us an email, I can send you out a list of those that we trained at that May training. But there's also been additional trainings throughout the state. The Department of Defense did a training, and the Department of Health has done a training. So there's more trainers even than we have trained. So if you contact your local early childhood council, they should be able to inform you who's trained in your area.
Thanks so much. Do we have any other questions? Well, I thank you so much for joining us this afternoon. As you exit the webinar, you will receive a survey, so please fill out briefly. You don't need to put too much unless you want to. We're always happy to get feedback, hear about what you thought about the webinar, if we answered your questions, and if there's any subjects, or if there's one of these areas that you'd like us to drill down on, please let us know. Thanks again for your time, and we look forward to seeing you on our next monthly webinar. Christina and I are in the process of figuring out a time for that, so if you have any ideas on that, let me know. Have a great afternoon, and I look forward to seeing you soon. Thanks.
A few people.